Living with low blood pressure can be just as challenging as living with high blood pressure. In this video, we'll cover the causes, effects, and treatment options for low blood pressure, also known as hypotension. You'll learn about the potential health consequences of low blood pressure, and what you can do to manage it through lifestyle changes, medication, or alternative therapies. By the end of the video, you'll have a better understanding of low blood pressure and how it affects your health. Blood pressure refers to the force of blood pushing against the walls of your arteries as your heart pumps it around your body. It is measured using two numbers: systolic pressure, the top number, and diastolic pressure, the bottom number. Welcome to Meducatives. This is the official YouTube channel of www.meducatives.com. We believe that awareness is everything and our goal is to promote it. Causes of low blood pressure. Low blood pressure, or hypotension, can be caused by a variety of factors, including dehydration. When your body loses too much fluid, it can cause a drop in blood pressure. Dehydration can result from not drinking enough fluids, sweating excessively, vomiting, or diarrhea. Medications. Certain medications, such as diuretics, beta blockers, alpha blockers, and some antidepressants can lower blood pressure. If you are experiencing low blood pressure as a side effect of medication, talk to your doctor to see if there are alternative options. Heart problems. Heart conditions like bradycardia, slow heart rate, heart attack, or heart valve problems can cause low blood pressure. A weakened heart muscle can also lead to a drop in blood pressure. Endocrine problems. Disorders of the adrenal glands, such as Addison's disease, can lead to low blood pressure. In this condition, the adrenal glands do not produce enough hormones, which can cause a decrease in blood pressure. Pregnancy. Pregnant women may experience low blood pressure due to hormonal changes and increased blood flow to the baby. It is common for blood pressure to decrease in the first 2 trimesters of pregnancy before returning to normal in the 3rd trimester. Nutritional deficiencies. A lack of certain nutrients like vitamin B12 or folic acid can cause anemia and lead to low blood pressure. Anemia is a condition where there are not enough red blood cells to carry oxygen to the body's tissues, which can result in fatigue, weakness, and low blood pressure. It's important to identify the underlying cause of your low blood pressure in order to determine the best course of treatment. Effects of lower blood pressure. Low blood pressure can cause a range of symptoms and complications. Some common effects of low blood pressure include dizziness and lightheadedness. Low blood pressure can cause you to feel dizzy or lightheaded, especially when standing up from a seated or lying position. Fainting. In severe cases, low blood pressure can cause fainting or loss of consciousness. Fatigue and weakness. Low blood pressure can lead to feelings of fatigue and weakness, which can impact your ability to perform daily activities. Confusion or difficulty concentrating. A drop in blood pressure can affect blood flow to the brain, leading to confusion, difficulty concentrating, or even memory problems. Chest pain or shortness of breath. Low blood pressure can reduce blood flow to the heart, leading to chest pain or shortness of breath. Kidney damage. Low blood pressure can reduce blood flow to the kidneys, leading to kidney damage or even kidney failure. Shock. In severe cases, low blood pressure can lead to shock, which is a life-threatening condition that occurs when there is not enough blood flow to the organs. Treatment options for lower blood pressure. The treatment options for low blood pressure depend on the underlying cause and severity of your symptoms. Some common treatment options include lifestyle changes. If your low blood pressure is caused by certain lifestyle factors, such as dehydration or malnutrition, your healthcare provider may recommend making changes to your diet and hydration habits. Eating a healthy diet, drinking plenty of fluids, and avoiding alcohol and caffeine can help to increase your blood pressure. Medications. If lifestyle changes are not enough to raise your blood pressure, your healthcare provider may prescribe medications, such as fludrocortisone or midodrine, to help increase your blood pressure. Compression stockings. Compression stockings can help to increase blood flow to your legs, which can help to increase your blood pressure. Treating underlying conditions. Dehydration. The treatment for dehydration-induced low blood pressure involves replenishing fluids and electrolytes in the body. This can be done by drinking fluids such as water, sports drinks, or coconut water, or by receiving fluids intravenously in severe cases. Medication-induced low blood pressure. Adjusting the dosage or type of medication, discontinuing the medication if possible, or adding another medication to counteract the blood pressure lowering effects. Blood loss. Stopping the bleeding and restoring blood volume. This can be done through transfusions of whole blood or blood products, or by administering intravenous fluids. Heart problems. Heart conditions. In some cases, medications such as beta blockers or calcium channel blockers may be prescribed to regulate blood pressure. In severe cases, surgery may be necessary. Endocrine disorders. Addressing the underlying hormonal imbalance. This may involve hormone replacement therapy or medications to regulate hormone production. Nutritional deficiencies. Addressing the specific nutrient deficiency. This may involve dietary changes or supplements to increase the intake of nutrients such as iron, vitamin B12, or folate. Pregnancy-induced hypotension. Treatment options for pregnancy-induced hypotension may include increasing fluid and salt intake, monitoring blood pressure closely, and in some cases, medication may be necessary. Infections and illnesses. This may involve antibiotics or other medications to treat the infection or illness, as well as measures to maintain fluid and electrolyte balance. Genetic predisposition. Understanding familial hypotension. Treatment for familial hypotension may involve medications to regulate blood pressure or lifestyle changes to manage the condition. In some cases, genetic counseling may be recommended for affected individuals and their families. It's important to note that some people with low blood pressure may not require any treatment, especially if they do not experience any symptoms. However, if you have persistent symptoms of low blood pressure or if your blood pressure is causing complications, it's important to speak with your healthcare provider to determine the best course of treatment for you. Conclusion. Lower blood pressure is a condition that can impact anyone, and it's important to understand the causes, effects, and treatment options to manage it effectively. While low blood pressure may not be as dangerous as high blood pressure, it can still lead to complications and affect your quality of life. If you have concerns about your blood pressure levels, be sure to speak with your healthcare provider to determine the best course of action. Remember, making lifestyle changes such as eating a healthy diet, staying active, and reducing stress can also help to naturally lower blood pressure levels. Thanks for watching. Please visit our website www.meducatives.com. You may like our free ebooks and medical and health educational products on our website. If you enjoyed the video, please consider subscribing, sharing, liking, commenting, and pressing the bell icon to receive notifications for more content like this. Lastly, don't forget to follow us on Instagram, Facebook, and Twitter.